Dengue fever is a tropical disease caused by a virus carried by mosquitoes. The virus can cause fever, headaches, rashes, and pain throughout the body. Most cases of dengue fever are mild and go away on their own after about a week. What causes dengue fever? Dengue fever is caused by 4 similar viruses spread by mosquitoes of the genus Aedes, which are common in tropical and subtropical areas worldwide. When an Aedes mosquito bites a person who's been infected with the dengue virus, the mosquito can become a carrier of the virus. Aedes mosquito bites someone else, that person can be infected with the dengue virus and can then get sick with dengue fever. The virus can't spread directly from person to person. In rare cases, dengue fever can lead to a more serious form of the disease called dengue hemorrhagic fever (DAF). DAF can be life-threatening and needs to be treated right away. What are the signs and symptoms of dengue fever? Symptoms of dengue fever are generally mild in younger children and those who have the disease for the first time. Older kids, adults, and those who have had a previous infection may have moderate to severe symptoms. High fever, possibly as high as 105 F40C. Pain behind the eyes and in the joints, muscles, and/or bones. Severe headache. Rash over most of the body. Mild bleeding from the nose or gums. Bruising easily. Dengue fever used to be called breakbone fever, which might give you an idea of the severe bone and muscle pain it sometimes can cause. The fever isn't actually breaking any bones, but it can sometimes feel like it is. How long does dengue fever last? Symptoms can start anywhere from 4 days to 2 weeks after being bitten by an infected mosquito, and typically last for 2 to 7 days. After the fever eases, other symptoms can get worse and may cause more severe bleeding. Gastrointestinal problems like nausea, vomiting, or severe abdominal belly pain, and respiratory problems like difficulty breathing. Dehydration, heavy bleeding, and a rapid drop in blood pressure shock can follow if DAF goes untreated. These symptoms are life-threatening and need medical care right away. How is dengue fever diagnosed? You think your child might have dengue fever? Call a doctor right away. You should also call a doctor if your child has recently been to a region that has dengue fever and has a fever or severe headache. Can dengue fever be prevented? Use screens on doors and windows, and promptly repair broken or damaged screens. Keep on-screen doors and windows shut. Have kids wear long-sleeved shirts, long pants, shoes, and socks when they go outside, and use mosquito netting over their beds at night. Limit the amount of time kids spend outside during the day, especially in the hours around dawn and dusk, when mosquitoes are most active. Don't give mosquitoes places to breed. They lay their eggs in water, so get rid of standing water in things like containers and discarded tires, and be sure to change the water in bird baths, dog bowls, and flower vases at least once a week.